Hello guys, welcome back to our new video. This is Sudhimitan, 6th year medical student in Crimea Federal Medical University. As everyone know, outbreak of the coronavirus. So today I'm going to tell you about the coronavirus, about its structure, how coronavirus is spreading, how it attacks the body, and what are the recommended precautions to take. So let's start. Coronavirus discovered in 2019. It is mainly spread in China, then later in other countries like Italy, India, and all over the world. This virus is also called 2019 novel coronavirus or Wuhan coronavirus. According to WHO, virus officially named SARS-CoV-2 because it's genetically similar to SARS coronavirus, which was responsible for severe acute respiratory syndrome in 2002. So SARS-CoV-2 caused COVID-19. So now let's discuss about mechanism of action. Coronavirus attacks the respiratory system and responsible for common cold. It spread through ingestion or inhalation of viral droplets. As a result, sneezing, coughing, and touching infected surfaces are primary source of infection. It is a single-stranded RNA virus with protein spike on it, which help to bind in respiratory system of humans. Proteins used by virus to enter in human cells the mostly connect to angiotensin converting enzyme 2 receptor. Exactly mechanism for this is not known, so we don't know the mechanism of action for 2019 coronavirus. COVID-19 is originated in bats, then in pangolin. It is intermediate host. From pangolin it spread to humans. In February 2020, university researchers in China employing genomic sequence found 96% match between coronavirus and pangolin and SARS-CoV-2. Pangolin meats are used in Chinese traditional medicines, so this virus is responsible for 2019-20 coronavirus outbreak and spread all over the world from pangolin to human. Now if we will discuss about early study of 2019 novel coronavirus, we came to know about virus pathology. Early study of 99 infected patients showed the mortality rate was 11% and ICU admission rate was 23%. And early study described the virus pathology. 8 days incubation period, 7 days of infection, and after that 9th and 10th day of hospitalization and ICU admission. Now let's discuss about statistics. Number of cases has been increasing from January 2020 till today. It's been around 109,578 cases from January 1st to March 9, and number of death is 3,809 with fatality rate is 3.5%. Fatality rate was initially 16% till January 10, then it began to decrease and it came down to 0.8% till February 1st. It's mainly attributed to better testing and process going on. So if we compare with others, coronavirus has 3.5 fatality rate, and 2002 SARS outbreak result in 8,098 cases and 774 deaths and fatality rate was 9.6%. After that, in 2012 MERS outbreak resulted in 2,494 cases and 858 deaths with fatality rate 34%. And at last, Ebola outbreak in 2014 resulted in 28,639 cases and 11,316 deaths with fatality rate 40%. In COVID-19, the fatality rate differ by group. For example, if we split out by age, you can see here the fatality relatively low if you are below 60, with no deaths seen in children at 9 and younger. But then it start to increasing in elderly age, so they are really higher at risk. Similarly, fatality rate is higher with hypertension, diabetes, cardiovascular disease, chronic respiratory disease, and cancer. So people who are at higher risk are elderly, like after 60-year-old, and people with this disease. Sometimes some people do not develop symptoms or mild, and other symptoms develop like fever, cough, shortness of breath, and in serious condition like pneumonia. Severe lung damage causes acute respiratory distress syndrome or ARDS, which occurs when lung inflammation is so severe that fluids built around and in the lungs. Severe infection can cause septic shock, which happens when blood pressure falls very fastly and body organs starving for oxygen. ARDS and shock are main cause of death for people with the infection, and it's most likely occur in over the age of 60, smokers, and patient having previous medical condition like hypertension and diabetes. Now let's discuss about diagnosis and treatment. To confirm, we can do real-time polymerase chain reaction. It can be used in many labs and hospitals to detect the viral RNA. We can take sputum, swabs, lavage, serum for samples. Treatment based on supportive care, providing fluids, oxygen, ventilation support. There are no exact treatment, but there are three medications which are highly effective against corona are chloroquine, ritonavir, remdesivir. Now let's discuss about prevention. There are no vaccines to protect against coronavirus, so better to avoid human to human transmission. Firstly, isolation of infected person with COVID-19. Coronavirus cannot spread with long distance in air but can transmit it in range of 3 feet 1 meter, and sometimes it can survive on surface for over a day. Next is avoid travel to outbreak areas. Stay away from crowded places. Stay at least 6 feet or 2 meter away from anyone who is having symptoms. Wearing a surgical mask is not recommended because it's not a airborne disease. Careful hand washing is best way to prevent. It should be done with soap or alcohol based sanitizers. Avoid touching eyes, nose and mouth. This areas is known as T-zone and common entry point for virus. So guys, this is all about coronavirus. Don't be panic, you just have to take some precautions and stay healthy. If you like this video, please share it as much as possible. It can be helpful for your friends, family and other peoples. And if you have any doubt, please feel free to ask in the comment box, or you can message me on my WhatsApp number which is given in the description box. At last, I'm going to say you like, please subscribe our channel and share this video as much as possible. Till then, bye, have a good day, stay safe, stay healthy.